health segment is brought to you by Lipton Yellow Label Tea, your number one tea brand in the world.
The prostate is only found in men. It's about the size of a walnut and lies inside the pelvis underneath your bladder. It surrounds the urethra, a thin tube that carries urine from the bladder through the penis where it leaves the body. The prostate produces and stores a thick fluid, which is a major part of semen. As you grow older, your prostate may get bigger. This is known as prostate enlargement, or benign prostatic hyperplasia, BPH. It is still not fully understood why the prostate enlarges with age, but growth hormones such as testosterone and estrogen undoubtedly play some role. This condition is not dangerous, but may affect urination as the enlarged prostate squeezes your urethra. In some men, treatment is needed to alleviate symptoms. Having prostate enlargement does not increase your risk of developing prostate cancer. However, some of the symptoms may be similar, so it's important to see your doctor if you notice changes in urination. Prostate cancer is the most common cancer in men, with most cases developing in men aged 65 and over. It occurs when cells in your prostate multiply abnormally and form a tumor. Prostate cancer usually progresses very slowly. It can take up to 15 years for the cancer to spread beyond the prostate, and initially you may not experience any symptoms. However, as the tumor grows, cancer cells may spread to the surrounding tissue, lymph nodes and bones. If you are diagnosed with prostate cancer, your team of doctors will discuss treatment plans with you. The type of treatment recommended will depend on your age, the likely progression and stage of your cancer, and possible side effects of treatment.
Good morning once again, and welcome back to a new day right here on TV3. Now it's time for us to talk some health, and you just saw from the video there that we are going to be discussing a very prevalent illness that actually seems to be creeping up on us quite a lot, especially here in Ghana at this moment in time. We're going to be talking about prostate cancer. Now I just want to clear something up. At the beginning of the show I said that my dad had prostate cancer. It was actually colorectal cancer, not prostate cancer, so it's slightly different. So I apologize for that. But with us this morning, we have the CEO of Medi Prostate Center. He is Dr. De-Gaulle. Good morning, sir. How are you?
Good morning, and you?
Fine, thank you. Welcome to the show. Prostate cancer. I mean, what's the current state of prostate cancer within Ghana as we speak?
Presently, just about 5% of men will have prostate cancer. Prostate enlargement is two things, either benign or cancerous. Mm-hmm. The commonest one is the benign prostate enlargement or benign prostate hyperplasia, which most men will go through as they age.
Right.
The difference between the cancer and then the benign is that the cancer, as we saw in the video, tend to spread. The cancer means that the cells decide to multiply uncontrollably. The body is made in such a way that once tissues start multiplying, there's a stage they stop multiplication, and then they die off and another one is formed again. But once the cells become cancerous, once we say it's cancer, that means it's multiplied without stopping.
Right.
So it's uncontrollable. The body cannot control it. So it multiplies from the sites, especially like prostate cancer, from the site where the prostate gland is situated, just below the bladder. It can multiply from that place and move into the pelvis. From the pelvis, it shoots into the other organs. Goes into the bones, the spine, move into the liver, move into the lungs, can even move into the brain.
Wow.
So once it's cancerous, it's dangerous. But the most commonest one is the benign prostate enlargement, which most men, about 80% of men, as you age, you will definitely go,
right,
you may go through it. and it comes with certain signs and symptoms. Once your prostate is enlarged, there are urinary symptoms that comes along with it, like you tend to urinate frequently in the nights and also in the day, so that it tends to impair your sleep. You wake up, you go and urinate in the night. Just about 30 minutes when you are back on the bed, you feel like urinating again. So you wake up again, go and urinate. And when you come back, same thing happens. About 30 minutes, 1 hour, you feel like urinating. So
That's
you cannot
pressure
sleep
on the
throughout.
bladder, is that?
Yes, because the urinary bladder is just situated on top of the prostate. The passage, what we call the urethra, goes through the prostate before coming into the penis. And then when the prostate is enlarging, it's made in such a way that the outside of the prostate is tight. There's a capsule, so you cannot enlarge outside. It's enlarged inwards, and the urinary bladder, the urethra, passes through the prostate, so it tends to occlude or clamp the passage of the urine.
Right.
And so these symptoms come. You also have urgency of urinating. When you wake up, you feel like urinating, you cannot hold it. Immediately you have to go and urinate.
Okay. Let's talk about treatment in Ghana.
Yes, there are various forms of treatments when we look at prostate enlargement, made up of prostate cancer and benign prostate hyperplasia. The various forms of treatments, it could be medical treatments, and there are about 6 different group of drugs, orthodox drugs that are available for treatment, for kind of management. It's not like a treatment, it's to manage it. And there's also a herbal option where we come in, yes, okay. Where we come in from the Medi Prostate Center, where we formulated a food supplement that shrink the prostate back to normal within a short time.
Short time?
So it's not...
What period is short?
We're talking about from 2 weeks, depending on the size of the prostate. So we're talking about from 2 weeks to 3 months.
So if it shrinks, it doesn't mean the problem is you've cured it totally?
Once it shrinks, then all the symptoms that come along with the enlarged prostate will go away. So you're okay.
And this is only available at your center?
Only available at Medi Prostate Center at Adenta Barrier and also at Kumasi and Inuma Kokobin.
Why wouldn't you make it available to other centers?
We are very careful not to put it out of the market because of imitation. So what we are doing is that we want to keep it close to our chest so that people cannot imitate it. And with time, we're also thinking of spreading out from one region to other. We are now in Ashanti region. We are planning of going to Tamale, Takrade, and then other regions.
Okay. Now you mentioned about this herbal option shrinking the prostate in order to, and that releases some of the pressure on the urethra. Is that correct?
Yeah, that's
now,
right.
in doing so, does that mean that if you previously had problems with urination, the frequency, and the fact that you want to wake up and you feel like bursting, will that subside and it will disappear or dissipate?
All the symptoms will disappear, including like when you are urinating, because the passage of the urethra has been clamped, like blocked. You have to strain before the urine comes.
Right.
You strain, and the urine does not come with force. It comes very slowly.
Right.
It's weak. We call it a weak stream, and sometimes it breaks up as the urine is flowing. It starts breaking. You have to be pushing before it comes.
Yeah.
All because of the blockage. And other symptoms include sometimes you go and stand there, you want to urinate, but the urine won't come. You wait and wait and wait and wait and wait before it starts coming slowly. You see a young man coming to urinate and go away, another one coming and go away. You are still standing there, and
frustration.
It's quite frustrating. It's quite distressing.
Because there's a myth of surrounding prostate cancer that it's a rich man's disease, and it comes about by living lavishly, eating lots of meat, alcohol, over sex apparently is one of the causes, and diet and such. I mean, how true is that?
In a way, we look at diets as part of the cause. Excessive alcohol, excessive smoking, a lot of red meats can predispose. It's not direct cause, it's predisposition. Green vegetables, green leaves, cabbage, watermelon, a lot of tomatoes, all these things help for the health of the prostate. So you avoid alcohol, you avoid smoke, you avoid a lot of meat. Then you eat a lot of green vegetables, you eat a lot of this watermelon, lettuce, the tomatoes. Tomatoes is known to contain certain chemicals that inhibits, we call it lycopene, that inhibits the progress of disease. The cause of the enlargement is just due to one hormone that we know, one or two of them, testosterone, to a lesser extent, estrogen. Now, testosterone makes a man who you are, makes you grow nice beard like you have.
Thank you.
Make you behave like a man, talk like a man, perform in bed like a man.
Yep.
That is testosterone. Now, the same hormone has been implicated as the cause of the enlargement. It serves as a source of food for the prostate to grow.
All right.
You know, the function of the prostate gland itself is to produce something we call prostatic fluid, or what we see as semen. When you have orgasm, what comes out is produced by the prostate, is the semen. Now, the semen, or let's say prostatic fluid, serves as a source of food for the sperm. The sperm is produced in the testis, but then join the prostate, the prostatic fluid, and then comes down through the penis. That causes fertilization, or if there's no fertilization, that comes out as a form of orgasm. So the function of the prostate is to help the man to reproduce.
Right.
Yes, and it's also serve as a food and a transport medium for the sperm. But once man ages above the age of 35 years or so, the prostate glands start to enlarge naturally. And so it's not, you didn't cause it. It's just like growing up and having a gray hair.
Okay, so when you turn 35, when a man is 35, he should start being careful or getting worried. We'll come to that. Let's talk to George calling from Secondary, because we have splashed the numbers on the screen so you can ask the doctor here any question about prostate cancer. So George, we are listening to you. Good morning.
Good morning, madam.
What's your question?
Well, my problem is I urinate a lot. But secondly, I drink too much water in the night. Does it mean that I want to know whether I have prostate cancer, or is because of the water that I drink a lot that makes me to urinate?
Thank you for your question, George. Thanks for calling.
Yes, when you drink a lot of water, the body has a limit. The body has to be in a state of equilibrium at all times. So when you drink a lot of water, excess water, the body doesn't like it. You get rid of it. So the more fluid you take in, the body will take certain amount, leave the rest to go. So that is it. That is it. But then if you drink, you have excess tests, you drink a lot of water, and you drink frequently, it could be different other disease like diabetes, for instance. So you need to check up. If you feel thirsty all the time and you drink water all the time, it could be diabetes. So go to your doctor, let your doctor find out what you have. Now, the difference between diabetes and prostate is that as for the prostate, you will feel thirsty, but you urinate frequently.
Right.
Okay.
Yeah.
Okay. I believe we're going back to the phone lines now. Good morning. Hello. Hello.
Hello.
Hi. Good morning. What's your name and where are you calling from?
My name is Cherno. I'm calling from the University Guest Center in Legon.
Okay. And what's your question, please? Can you please turn down your television set for us, please?
I am from the Gambia, and I've been diagnosed with enlarged prostate.
Okay.
I wanted to know how I can get in contact with the doctor
Okay.
so that I can access the food supplements he mentioned.
Okay.
Yeah, we are located at Adenta Barrier in Accra. Our telephone number is 0244068447.
Okay, slowly with a number.
0244068447.
All right.
That's our telephone number.
So 0244 067.
068447.
Okay, I don't want to get.
Hopefully you've taken down that number. You can give the
And we
number a
also
call.
have 020-814-0668. We are also located in Kumasi, Ahinema Kokobeng, in Kumasi. So you can also check us out at Kumasi.
All right. But please don't call the doc now because we're actually doing an interview.
Okay, now let's talk about, we were on the point about when you're 35 and going.
Yes.
How often should you go check, your prostate out?
Yes, I always say that once you are above the age of 35 years or so, check your prostate at least once a year. Make it your birthday present. On your birthday, instead of going out to go and chill, go to the hospital, check your prostate. It will benefit you a lot. Sometimes the prostate can be enlarged, but there will be no symptoms at all.
Here's one thing, Doc, because the testing, right? Now that's one big thing that's prevented men from getting tested a lot. They see it as a violation. Because obviously the way they were testing before it was a violation. You know what I'm talking about. But right now, how is it that they test for prostate cancer? Because I know for a fact that was a deterrent.
Previously,
yes.
like in the textbooks, what we see is that you do the digital rectal examination.
That's right.
Which is what you say is violation. You have to stick your finger
Literally
in there and do that, blah, blah, blah. But these days, there's modern techniques that we use, There's this ultrasound machine. You can use abdominal ultrasound that will give you the size and the weight of the prostate.
Right.
So it's not invasive.
It's not
no,
necessary for anybody to do that.
No. It's just simple test. We also check your blood for what we call PSA, and we do other routine checks like checking for your urine, for instance, because when you have prostate problems, it comes with another complication if it's not well treated or if it's not taken care of. It comes with diseases like what you call urinary tract infection.
Yeah.
Because the blood, you cannot empty your bladder fully. Sometimes when you urinate, you still feel like the urine is still staying there. Now, once the urine stays in there, it becomes infected.
Okay.
Then we have urinary tract infection, which comes with another symptoms like also urinating frequently, but then you also have pains when you are urinating. You have burning sensation in the penis when you are urinating. You also have a lower abdominal pain.
Okay, let's talk to Clement calling from East Legon. Good morning, Clement.
Yes, good morning, Nanaba.
Your question.
Hello, Nanaba.
Clement, I can hear you very well. What's your question for the doctor?
Okay, great. I just want to find out what effect you are likely to get out of regular sex habits, and I also want to know if that is a possible cause for prostate cancer. What about the effect you may get out of getting BJs? I want to know if all of this can contribute to you getting prostate cancer.
Okay,
thank you.
thanks.
Right.
Thanks,
It has been a myth, as you said, that people associate enlargement of the prostate gland to excessive sex.
Yeah.
But research has never proven that point.
What about what he said, oral sex?
The oral sex has never proven to be a cause of enlargement of the prostate. As I said, the cause is natural. As you grow, it becomes. You see, the way women get menopause. Women get menopause after some age, 39 years or so. Men also get their papapause.
Right.
So
we
that's
should
the
expect
problem.
it.
Yes, you should expect it.
Okay.
But unfortunately, most men don't know about it.
Right.
I have a professor friend who had attack of the prostate. He went to a funeral and he wanted to urinate, and the urine won't come again. He didn't have any prior knowledge, no previous symptoms. Then all of a sudden, the urine will not come.
How dangerous is that if the urine is not coming out?
It's quite terrible if you cannot urinate.
I mean,
You
imagine
feel
the
that-
fact that when you need to pee and you
Yes.
can't at that point in time. That sensation
It's
alone is something.
very, very uncomfortable. Very, very uncomfortable.
So in that situation, what did you do? What happened?
Yes, when it comes like that, it's like we have what you call retention of urine. So we need to first get the urine out.
Catheter.
You put urethral catheter through the penis, and then get the urine out. And then we assess the weight of the prostate. If the weight is too much, the normal weight of the prostate is about 40 grams. But some people will come with a prostate weight about 300 or 350 grams. So in that case, you see that it's too much. You have to keep the catheter inside for some time until we give you the medicine, we give you the food supplement for it to
Shrink
shrink
again.
back to normal before we take the catheter out.
Wow. All right, we're going back to the phone lines right now. I believe we're going to Kumasi. Good morning.
Good morning.
Hi, what's your name?
I'm Patty.
Hi, how are you?
I'm fine.
Great. What's your question for the doctor?
Okay, I'm 3 years, and for the past
3 years. Anytime I feel like urinating and I delay for 30 minutes or so, it becomes difficult for me to urinate. It doesn't flow easily, whether at night or during the daytime. And I would like to also know the cost in managing this or the cost in treating it if I have the enlargement of the prostate.
Okay, good point. Thank you for your question. All right, so firstly, it was about his...
What his experience is what we call hesitancy. You feel like urinating. Maybe you delay, you are doing something, you are occupied, so you delay a bit. But when you want to go to urinate, you are ready to urinate, then you won't come. It's called hesitancy. It's one of the signs and symptoms of an enlarged prostate.
Okay.
So he should get himself checked.
Right.
And
he made a good point as well. I mean, what's the average cost of treatment when it comes to
the average cost is about, including the consultation, the card, the lab test. You check your urine, you check your blood. We do a scan for you. The blood, what we check, we do a full blood count. We do prostate-specific antigen to find out whether it's enlarged, it's cancer or it's not cancer. That will give you a level of an idea. So all this, including the drug itself, the medicine itself that we give to you, it's about 350 Ghana cedis.
350 Ghana cedis.
Is it covered by the NHIS?
Not yet.
Not yet.
So
it's quite expensive.
I like that. You know, that's the question that we're going to be asking most people now when they talk about it. Is it covered by the NHIS?
Okay, let's talk to James calling from Ho. Good morning, James.
Good morning, how are you?
I'm good. Your question,
Thank
please.
you for, please thank you for your program. My son, one of his testes is not showing up. One is bigger than the other. When I went send him to the hospital, they say it is a hydrocele. But I want to understand more from the doctor right there since he's in front of me.
Okay.
Right. Probably the doctors have diagnosed the case as a hydrocele. Hydrocele means that there's accumulation of water in the testis.
Okay.
And you need to see your doctor for an intervention. You could do minor surgery to correct it.
Okay.
It's not something you should be afraid of. See your doctor.
So what you're saying basically is that people under 35 cannot be diagnosed of the prostate.
No.
It is rare.
I have seen cases, 27-year-old man who have a very huge prostate.
Okay.
And prostate tends to run, the prostate enlargement tends to run in the family.
I was going to ask you,
that means that when your father have it, the son will have it, and the son's sons will have it, and it's going to travel down a generation after generation.
And age doesn't matter.
In that case, when it's running in the family, you can get it easily. You can get it quite earlier than normal population.
So for instance, if your father has got prostate cancer, what are the chances that you have it? I mean, is it over 50%, or is it a fact that you will end up having an enlarged prostate or prostate cancer?
Let's put it this way. When your father have an enlarged prostate, you are definitely going to have an enlarged prostate.
You definitely?
Yes, you will have it. It's definite. It's coming. It's on the way, waiting
How
for
do
you.
you prevent it?
Wow.
You can't prevent it? There's nothing you can do
Prevention
about
is when we are talking about checking, regular checking. When you are aware, when the awareness is there, that's my father have it. So keep checking. At the age of maybe even 30 years, keep checking every year. So once you keep checking, you monitor it. When it's getting bigger, you control it. So back to normal.
All right, we're going back to the phone lines for our last phone call. Good morning. What's your name? Where are you calling from? Apparently, we've actually lost the call. No problem. We'll try and see if we can get them back on the phone lines.
So apart from your center, which other facilities provide treatment? For instance, would you say that the facility at the Kolebu Teaching Hospital, presents the best treatment for patients?
Well, I don't want to stray into that area.
Why not?
What I want to say is that there are treatment options available across the country. But the most definite treatment that we cure is what we do at Medi Prostate Center. Right. We give you the cure.
Going back to the phone lines now, we've got Eric from Koforidua. Good morning, Eric. Hello.
Good morning.
Good morning, Eric. How are you?
Good morning.
Great. What's your question for the doctor?
Yes, I have this question for the doctor.
Go ahead.
Yes. according to the symptoms that the doctor gave, I have heard so many people also giving the same symptom as gonorrhea symptoms. Okay. All right. And then that is the first question. Do they have a relation, the gonorrhea and those prostate that have a relation in the way?
Okay. Thank you for your question, Eric.
Second issue is
Sorry, go ahead.
uh,
Yeah, go ahead, Eric.
the second issue is he was talking about this vegetables, tomato, but let's be realistic. These tomatoes, they grow with these chemicals and all these green vegetables. You go to the market and, my brother, full of. Now I'm afraid to take vegetables, especially tomatoes.
Okay, valid point, Eric. Thank you.
What do we do?
Thank you for calling.
Thank you, Eric. Valid point. Okay, so first things first. The symptoms of prostate cancer being similar to gonorrhea, and is there any relation?
No, gonorrhea, as we say, gonococcal infection is a sexually transmitted disease. It is not related to the prostate at all. But when you have an enlarged prostate, you can be predisposed to what we call a urinary tract infection, as I mentioned.
Yeah.
And people mistake urinary tract infection as a sexually transmitted or even gonorrhea.
Yeah.
It is not the same. They are two different things.
Okay.
Yeah.
And secondly, I mean, he said he's afraid to eat vegetables now. I think he's talking about pesticides and herbicides and all the other stuff that they use to grow them.
Yes. Most people have similar fear because of the way they are grown. They use very dirty water to try to water their plants as it's growing when you go to various places. But there are also various places where the tomatoes that is grown there, they are very neat. Akumadan, go there, you see very nice tomatoes, and most of these come to our cities. So you shouldn't be afraid. Wash it very well. Wash it. If it's still in doubt, have some vinegar to disinfect it so that you can
Nature's disinfectant.
Yes.
All right.
All right.
I have to say a big thank you to you for passing through. And if you can run your number by them once again.
Our number, we have two numbers, 020 814 0668. Then the other one is 0244 068 447.
All right. Well, thank you ever so much. This has been Dr. Dogbache. He's the CEO of Medi Moses Prostate Center. Thank you so much for coming in this morning. Let's not forget that the health segment is brought to you by Lipton Tea, inspiration flowing through nature. We'll be back in just a moment.
Health segment is brought to you by Lipton Yellow Label Tea, your number one tea brand in the world.
The prostate is only found in men. It's about the size of a walnut and lies inside the pelvis underneath your bladder. It surrounds the urethra, a thin tube that carries urine from the bladder through the penis where it leaves the body. The prostate produces and stores a thick fluid which is a major part of semen. As you grow older, your prostate may get bigger. This is known as prostate enlargement, or benign prostatic hyperplasia, BPH.